On the day of your surgery, please check in at the surgery lobby, which is on the 3rd floor of Sacred Heart Medical Center at Riverbend. You can come to the surgery entrance at the north end of the hospital and take the elevator up to the 3rd floor. Use multi-level parking garage S for surgery patients and visitors. There is elevator access to the surgery lobby on the 3rd floor of the hospital. After checking in at the front desk, you will have a brief wait before being escorted into the surgical procedure area, or SPA. This unit is designed to prepare you for surgery and provide a place for you to wait comfortably until the operating team is ready for you. You will be escorted to a private area where you'll find a hospital gown and socks to put on, and assistants will begin the general admission process by taking your vital signs, getting an IV started, and entering other information into your computerized chart, such as allergies to certain medications. The nursing staff will clip the surgical site and apply a sterilizing agent on your skin. You'll be given a medication to make you drowsy prior to going directly into the operating room. A maximum of 2 visitors will be allowed to stay with you in the SPA at any one time. Don't be afraid to ask questions. We do our best to see that you're made as comfortable as possible throughout your stay with us. During your surgery lobby check-in, you are assigned a patient ID tracking number so that your family can stay informed of your surgery progress. Different changing colors indicate your status as you move from check-in through surgery to recovery. These SmartTrack patient tracking monitors are located throughout the hospital and can be accessed online through the peacehealth.org website. After the surgery, your family member or support person will be contacted by phone or pager so they can talk with the surgeon and be informed of how the surgery went and how you're doing in the recovery unit. Once you leave the SPA for transport to the OR, your family and friends should expect a 4 to 6 hour wait before they will be able to see you again in your patient room on the 6th floor.
Welcome. This is the operating room at Sacred Heart Riverbend. In this room is where your surgery will take place. By the time you get here, you should be fairly sleepy from the medicine the anesthesia doctors would have given you in preparation for surgery. When you come in, you'll see a team of specialists preparing the room for your operation. We maintain a very high level of sterility to protect you during your surgery. Your time here will pass very quickly, and before you know it, you'll be in recovery room, ready for your rehabilitation.
In the operating room, you will see big overhead spotlights and assorted equipment around the room. There will be nurses and doctors wearing gowns and surgical masks preparing the surgical instruments. You will be asked to slide over to the operating room table from your bed. The table will seem narrow and firm. The room will be cool. The anesthesia personnel will place sticky patches on your chest and hands to monitor your heart rate and breathing, as well as a blood pressure cuff on your arm to monitor your blood pressure. When these are in place, you will hear the monitor beeping in conjunction with your heart rate. If you have chosen a spinal or epidural anesthetic, the anesthesia doctor will ask you to lie on your side in order to insert the catheter into your spine. If you have chosen a general anesthetic, medication will be administered through your IV. Your surgery will take anywhere from 1 to 2 hours, depending upon the status of your knee. Revision surgeries may take longer. You will wake up in the recovery room in your hospital bed. Nurses will be taking your blood pressure and heart rate frequently. You will feel a compression device on your legs. Pain medication will be given to make you comfortable, and x-rays will be taken of your new joint replacement. You will remain in the recovery room 2 to 3 hours and be moved to your room when you are fully awake or when your spinal anesthesia has worn off.
Hi, my name's Patty. I'm one of the orthopedic nurses here at Sacred Heart at Riverbend. I'm part of a team of professionals who will be working with you as you recover from your surgery.
Sacred Heart Medical Center strives to create a healing environment that ensures the care you receive meets your individual needs. We realize that each person comes into the hospital with different expectations and goals. Although there are certain tasks that we routinely need to complete, such as taking vital signs and administering medication, our staff will work with you to make your stay as pleasant as possible. A special note for family and support people. Recovering from knee replacement surgery is a team effort, and you are an important part of the caregiving team. We want you to be included in patient teaching during your family member's hospital stay. We want you to feel welcome to participate in your family member's care. If you have any special needs or questions, please direct them to any of our staff members. We will assist you in any way possible. Remember to eat and sleep well and take care of yourself. Your health is important in helping your loved one recover from surgery. You can expect to stay in the hospital 3 or 4 days after surgery. During this time, pain management will be an important part of your care. Pain is measured on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain imaginable. The goal is that you are comfortable enough so you can move, exercise, and participate in therapy. After the first day, your nurse will monitor your pain level and give you oral medication to manage your pain. Various devices in your room may be unfamiliar to you. Surgical drains and reinfusion devices will be attached to your bed. An incentive spirometer is a breathing exerciser. You'll notice a compression device on your legs that alternately tighten and loosen. This improves the circulation in your legs and helps prevent blood clots from forming. Cooling pads help reduce pain and swelling. Your recovery after surgery will follow an active schedule of nursing care, instruction, and exercise. It will start slow at first, but you'll be encouraged to set daily goals and accomplish certain tasks. A comprehensive physical therapy program during your hospitalization is crucial for your full recovery. Once you're awake enough following surgery, you'll be asked to begin the simple exercises that you practiced before surgery to keep the blood moving in your legs and speed recovery time. As part of your recovery, your physical therapist will set up a continuous passive motion, or CPM device, which gently bends and straightens your knee. You will use the CPM for up to 8 hours a day in 2-hour intervals during your hospital stay, gradually increasing the range of motion. Your therapist will also teach you how to become mobile with your new knee, sitting up, getting to a bedside commode or to the bathroom with a walker or crutches, and proper walking techniques. The goal is to increase your walking distance as you become more comfortable with crutches and putting weight on your knee. On the 3rd or 4th day after your surgery, you should be mobile enough to continue your aftercare program at home or at a skilled care facility. As a team, we will work together with you and your family or support person to prepare you for a smooth transition from the hospital. Things you'll need to know about are prescriptions, self-care for your incision area, and limitations on activities for the first few weeks. Arrange to have a mid to full-size car with adequate leg room pick you up at the hospital so you can stretch out your leg. We will show you how to safely get in and out of the vehicle. You may ride in the car 60 to 90 minutes at a time. If your trip will be longer, it's a good idea to do your ankle pump exercises and plan to stop every hour or so to stretch, change position, and walk around using your walker or crutches.